Hello, everybody. Welcome to the Voice of Saskatoon with Civically Speaking, and I'm here as one of the co-hosts, Lenore Swiston. I'm going to hand it around to my other co-hosts, and then we're going to jump into a really important session talking about the state of health here in Saskatchewan, focusing in on some wonderful guests that we have here today to give their insights, share their wisdom, share their experiences, and take some questions that we have for them. So over to you, Anika.
Yeah, my name is Anika. You guys have seen me host the Voice of Saskatoon. So I'm very excited to be here with three of our great guest speakers that we have. And we'll be talking about some very important topics. And yeah, I hope you guys enjoy the show. We'll be coming with more shows in the future. And make sure to follow our Facebook page, The Voice of Saskatoon and Civically Speaking. On to you, Rashid.
Thank you so much, Anika. Good evening, everyone. And my name is Rashid Ahmed, and I'm one of the co-hosts for Voice of Saskatoon. And I'm looking forward for today's conversation on healthcare system. And thank you so much for all the guests for joining us today. Over to you, Madhurja.
Thanks, Rashid. We have a really knowledgeable set of guests today. My name is Madhurja. I'm proud to be a host of this show, and hopefully you'll enjoy the show.
Awesome. And so we've got our first guest online, Dr. Hirani, and I'm just wondering if you can share a little bit about yourself.
Hello everyone, I'm Dr. Shaila Hirani. I'm an associate professor at the University of Regina, Faculty of Nursing. My area is maternal and child health nursing, and I'm also a certified lactation consultant. It's my great honor and pleasure to be here with you all at this wonderful show. Thank you so much.
Yeah, thank you so much. And then turning into the studio here, and it's great that we're able to do this because it really widens our access. So we're really appreciative of that. So thanks for joining. So we're going to go next to Tracy. Tracy, share a little bit about who you are and what you do and anything else you'd like to add.
Okay.
Just a little.
Yeah, I'll keep it brief. Tracy Mugley, and I'm the Executive Director at St. Paul's Hospital here in Saskatoon. I'm a social worker by training and profession, and I've worked in this realm for 35 years, and 10 of it being with CPAS, which is the organization that helps connect people to home care, long-term care, etc. And then 10 years as Director of Mental Health and Addiction Services, and now I'm at St. Paul's Hospital.
Yeah, so she's just a little busy these days.
A little, yeah.
Yeah, for sure. And thank you for coming on, because we know that we've had both you and who we're going to speak to here right away, Dr. Kendall. You know, we've had you on a few different episodes of Voice of Saskatoon and Civically Speaking, particularly during the pandemic, and just much appreciate the wisdom and experience that you share through that and the fielding of participants' questions. So thanks for joining us again. Dr. Kendall, please share a little bit about yourself and your background. And nice to have you in the studio today.
Family physician by training, but probably in relation to what we want to talk about today, my most significant experience in my career was serving for 15 years on the board of directors of the Health Quality Council. I did a stint as their interim CEO, and through that really got to gain much insight about health systems, what works well, and how you can continually improve health systems. And I was privileged to serve with two other citizens on the panel that recommended creation of the Health Authority. And our hope was that would lead to better integrated care for people across the province, because often rural people found their experience quite disjointed when they had to go back and forth between rural and intermediate and tertiary settings. And so with that background, I have done a lot of consulting with governments on contract to try and improve things. Sometimes those have been really positive experiences, sometimes they're frustrating experiences because you sort of hit a wall sometimes.
Yeah, for sure. And I think we'll hear a little bit about this because we know current context of health it's not a great one. Let's just say that. I think we can share that. We're here in the kind of the sacred space of the couch and the virtual couch, and we're here to have a conversation today. So we've got some questions, but if you have questions of each other, with your various different backgrounds and expertise in that, I think this will be a really good show, and hopefully listeners will have something that they can take away from this and maybe even apply into their own lives in some way. So there we go. Anika, over to you.
Yeah, perfect. So the first question is, we would love to know what you guys think are the biggest opportunities and challenges in our healthcare system today and why? So I'll start with Dr. Kendall.
Well, I think the opportunity, which is always ongoing, is to optimize the actual care experience for people, regardless of where they live in the province. We have a vast space to cover, and so it's challenging, and certainly to provide good comprehensive care in small communities, intermediate communities, and our large cities. But ideally, we need to tailor the services to, you know, the needs of the community. And I really feel it's important that we listen to people in the communities about what their experience is as they actually access care, so that we can then work with them to improve it.
Yeah. No, I love that, and I do agree. Coming from people who are actually in the front dealing with things, when you get that feedback, it's a lot more impactful, and that can help make a big change if you're listening and getting that feedback from the people who are actually in the front lines. So no, thanks for the answer. Tracy?
Opportunities.
Yeah.
Okay. I think that we're on the cusp of a lot of technological opportunities.
Lots.
AI may or may not be helpful to the situation, but I do believe that there are technological solutions now that are being introduced that can save a lot of money and save a lot of time in hospital, return quality of life. I'll give you an example. We have just introduced robotic surgery at St. Paul's Hospital.
Oh, wow.
And for thoracic surgery, we can reduce length of stay, recovery time in the hospital from what would have been 2 weeks just last year to 2 days.
Oh, wow.
So if you think about that technological advancement, you can actually serve more people. And when you're doing thoracic surgery and you're addressing somebody's lung cancer, time is of the essence, right? People need quick access. So I think there's some interesting technological solutions with robotic surgery. There's even now technology that we're just kind of looking into that can biopsy, lab test, and remove all in the same procedure.
Oh, wow.
So can you imagine being in an OR, going in for a biopsy and coming out and being told, we just removed your cancer?
Yeah. Oh, wow.
So there are some interesting technological opportunities ahead. I mean, a lot of them are going to involve a lot of money as well. But I think on the technological side, and hopefully there are opportunities too for just electronic health records, so we can bring people's stories together. They're so disjointed right now between service providers that you can't put the story together to get a full picture of what someone's experience is. So lots of opportunities there. Again, expensive, but really necessary. So, yeah.
Perfect. And you're right, it is going to be an expensive investment, but I feel like long term that could save a lot of time and money just once it's in place. But yeah, no, thank you. Love that. And Dr. Sorry, oh my God, I'm so sorry for mispronouncing your name. Shayla, go ahead.
Thank you so much for this important question. I would say that I would actually refer WHO's definition in here, because the way WHO defines health is that health is a state of complete physical, mental, social, emotional, and spiritual well-being, and not merely the absence of disease. So whenever this definition we are using as a reference, we would come to know that what are now the gaps in our healthcare system. Is it all the aspects of health are well catered in our health system or not? And definitely the answer is no. We most of the time are treating the physical conditions, but we do have lots of patients who are with so many needs that are like mental health needs, the social connection. There are emotional issues that they are going through while being in Canada, because there is so much of the isolation in most of the communities. There are many times when people don't have access to the healthcare system because they are living quite far from the major cities where hospitals are located. And also like spiritual care, I would say the another aspect which is very, very important, like many times that's something very much very easily overlooked, but even cultural aspect and religious aspect is equally important. So, referring back to WHO's definition that the way it is being proposed as having providing the community the best opportunities for having the greatest level of the physical, mental, social, emotional, and spiritual well-being should be something that I look forward to as a next level of opportunity in our healthcare system in Canada. That's something really requires more kind of a thoughtfulness. And apart from that, I'm also an active researcher in Canada, working very actively with the immigrant and refugee communities. And what I came to know through my interactions with the mothers, and the mothers especially who are with the young babies and also are in a state of the state of displacement. They mostly came from other parts of the world, either as a refugee or either as an immigrant, and most of the time they are the one who face so much of the racism in our healthcare system, which is not at all healthy in any ways. And here, like, I would share an example, like sometimes like people impose their own values and beliefs and kind of an expectation on others. And I once encountered a refugee mom who had like 6 children already, and she wanted to go ahead with her seventh delivery. The labor one was like due in few days. So somebody was a like person who was a translator for her, like proposed her that the healthcare providers have given her a form to sign without explaining, and when she was in the hospital she even signed a form without getting the literal translation for that document. And after her seventh baby, the next day she was taken to the operation theater, and later she realized that it was the procedure for her tubal ligation, because people who were sponsors or healthcare providers, they felt that 7 children are too many for her. But after that, like, this lady end up into so intense level of the postnatal depression, and later she was into the PTSD, and then she was undergoing number of treatment and wasn't able to well attend her all 7 kids with all her functionality as before. So this is just one an example of such case, but there are many such cases like those. And I always think for those kind of the population in our Canadian healthcare system who actually need the kind of the culturally appropriate care and services, so that sometimes is so much missed out that people really end up into more issues. And again, going back to World Health Organization's definition that no matter that physical, mental, social, emotional, and spiritual well-being could not be like taken care of in that scenario where something else or some kind of an external forces are not giving them a greatest support at their level best.
Perfect. No, thank you so much for the answers. And yeah, I loved hearing from all of you. Again, taking feedbacks, incorporating technology, and taking a more holistic approach to healthcare past that physical. So, thanks for sharing the answers. And yeah, over to Madhurja for the next question.
Well, I think we got to spend a little bit of time here, though, because there's the challenges aspect to it. So Dr. Harari kind of linked into some of the challenges, which I really appreciate too, in terms of if we're going to really address those health from a holistic end. So back over to you, Tracy, kind of picking up, because you talked about technology can be used for the good, and we can get more efficient and we can get more effective. But let's flip to that challenges side, because I know off air we were saying there's
segue.
stuff. Yeah.
Perfect segue, because one of the key challenges I see is the wellness of children and youth in that technological world. And I'm very worried about the mental wellness of youth in our society. I was having coffee with one of our emergency physicians this morning, and she said that last night in our hospital, 80 to 90% of the people that she was dealing with were substance use and mental health related presentations in the emergency department. So the presence of substance use and mental health is so magnificent right now that that really worries me as one of the greatest issues, and we have to be able to look to youth and kids to find ways to build resilience, build coping skills, and also make sure we address the determinants of health, that there's food security, income security, that they're safe. So that's one of the biggest challenges that I see is protecting, supporting our youth. So
Could I offer a comment about
Yeah,
the social
of
determinants of
course.
health? So it's interesting. One of the interesting things I'm doing right now is serving on an advisory committee with the Seniors Mechanism of Saskatchewan. And they received a $4 million anonymous contribution to help implement social prescribing
great.
on the part of physicians. Now, physicians are generally thought of as being very sort of, focused on disease as opposed to the social determinants of health. But there's really good evidence in other parts of the world that if you engage people in a way that connects them with other activities in the community, it enhances their health, as has been suggested. And so they're starting out with 2 projects over the course of 4 years. They're hoping to get a number of projects. One's going to be starting in Moose Jaw, one in a smaller community. And so in each community there would be a role called a community connector, and a physician, or it could be another member of the primary health care team, in conversation with the patient would say, I'm going to put you in touch with a community connector, and this person will help you identify resources in the community that will enhance your health. I'm quite excited about that.
So
that's
a-
brilliant
Yeah.
because
That's good news.
isolation is such a huge indicator of mental health for seniors.
Exactly.
Yeah.
But let's go a little deeper here, down an important path, because everyone's seeing it in their social media, hearing about it on the radio, can't turn a television on, if you still watch a television and watch news. But I mean, health challenges, it's right there. So Dr. Kendall, from your perspective, what do you see as the biggest challenge right now?
Well, I think the biggest challenge right now is the strain on our workforce.
Yeah.
Starting, of course, with the very acute phases of the COVID pandemic, and believe me, COVID is not over yet, but it has really exhausted the workforce, and in many areas we're finding that people are just losing, the capacity to continue to work in very demanding roles. And I certainly feel that one of the things perhaps we haven't seen is enough engagement of frontline workers by the Ministry of Health and government to really tap into what their experience is and how we can actually modify it. There's a finite number of health human resources, but it's interesting. I talked to nursing colleagues who are very frustrated with the travel nurse phenomenon, and so there is companies that engage nurses and they pay them substantially more than you get through the Sun collective agreement, and they go in various around the province, and when they're in an institution working with other nurses, it isn't that they don't work as hard, it's just that they aren't quite as deeply invested in the community and the setting, because they're sort of temporary. And I really think we need to try and bolster the morale of our workforce by listening to them.
Appreciate
and
that.
respond,
Dr. Rainey, is there anything you want to add in terms of challenges?
Yeah, definitely. Like one more aspect that I would add here, is the focus on the health promotion. Like most of the time, the curative aspect and rehabilitative aspects are where more of the investment goes. I'm not against it, but I'm saying that how about if more investment would have been on the health promotion aspect, so that nobody gets sick and end up into hospital or into the rehabilitation center. And again, those could be encouraged through the different routes, while having more public health nurses and more public health professions in the community where people are gaining access to those providers who can actually help them in promoting their health. And here the role of the different professionals come into account for the health promotion. I would say that during the pandemic, we have learned so much of the lesson for this aspect, because I remember, like, I'm being a lactation consultant, I'm very much into the breastfeeding counseling aspect. But unfortunately, what I came to know that during the time of COVID, when more requirement was there on the health promotion as well, apart from on the curative and rehabilitative, the health promotion part was like completely shut off. And most of those professionals who were previously responsible for providing the breastfeeding counseling services or the education to the community were routed towards the ICU and to the emergency care units. So that was a domain that really made many people more sick than before, because people were having the vaccine hesitancy even later, because they were not getting the proper education or teaching that why this particular vaccine gonna be so important for them to prevent them. And people really had the different myths and different practices at that time as well. So this is another important aspect that I consider as a challenge that needs more kind of a thoughts in our healthcare system.
You know, just to build on that, if
Yeah,
that's okay.
for sure, yeah.
The misinformation issue is so significant. I see that as a challenge that is really hard for any of us in our systems to manage. But misinformation about health treatment, health status, I mean, during COVID, obviously, that was a huge problem. So misinformation, like, how do we ensure that we teach our kids how to better discern what is accurate information, what is inaccurate, you know, being able to have that critical thinking skill, exactly, to know, okay, this is reality, this is not reality, this is valid information, this is not. So I think it's an opportunity, but it's a big challenge right now.
And I think, pinging again on the disinformation, particularly around immunization, you know, we had made such great advances in terms of childhood immunization, you know, preventing a lot of childhood deaths, quite frankly, and serious illness. And as a consequence of disinformation about immunization, you know, the rates of childhood immunization are dropping, and that puts children at great risk, and it's very, very disappointing.
Well, and now we're seeing diseases coming back that we never thought we'd see again, like measles.
Yes.
You know, where we thought we'd been in the clear, and now we're not. We're kind of getting close to the end of this kind of first half of the show. So is there anything else percolating in you in these last couple of minutes that you want to kind of share before we hand it over to our fellows on the desk there that's going to lead us into part two of this?
Well, I do want to comment on a news story that broke this week about the fact that the government of Saskatchewan had not really listened to the public health officers who wrote about steps that ought to be taken to protect the population during the peak of the COVID pandemic. And it is very, very concerning that we've lost the respect for expertise vested in people like public health officers. And, you know, there was the phrase that we're not going to have these restrictions because we don't want a Trudeau summer. And that just grieved my heart when I heard that, because it was just politicization of an issue which really should be driven by science and by, factual data from public health research and analysis. We have to get back to a strong public health standing where we deal with population health issues as opposed to, succumbing to the disinformation.
Yeah, and it's successful. Thank you for sharing that. Because there's sensitivity right now in the healthcare system.
Yes.
Depending on your role, Tracy, being in a hospital, there's sensitivities around what you can say, what you can't say, how you can navigate it. And as a professor, you've got some liberties that you can take there, but there's also within the bigger structure there. Any thoughts, Tracy, from yourself or Dr. Rainey?
I'll just add that I think one of the big opportunities we have is to get back to using data to make decisions.
Yeah.
We have databases. We have information. We have to use it to guide us into the right decisions. Good example, we have known what our demographics have been for a long time. We should not be in a situation where we don't have capacity to serve seniors in long-term care. We've known that bubble was on the rise a long time ago, and we didn't use the data to make the decisions at the time to make sure we had the capacity to meet the needs. So we have to, this is a lesson, let it be a lesson. We have to use data to guide decisions.
Yeah. Thanks for that.
No, perfect. Well, that brings us to the end of our first half, and great conversations. I can't wait for the second half. So yeah, I guess we'll see you all on the second half. Don't forget to follow us on our social media, The Voice of Saskatoon and Civically Speaking. So yeah, great show. Thanks. Welcome back to the second part of our show. We are the Voice of Saskatoon and Civically Speaking. We have three great speakers today. We have Dr. Kendall, we have Tracy Mugley, and on the internet, on our social media, we have Dr. Harnai. So I'm very excited for the second part of this conversation. And again, don't forget to follow us on our socials, The Voice of Saskatoon and Civically Speaking. This will be posted there as well for later. So over to you, Madhurja.
This show is about our community, about us, and so we're gonna announce something special that's happening in our community, a community event. It's a multicultural event that's happening. It's the African Heritage Fundraising Night that's taking place on May 3rd, and it's being organized by Truly Alive Youth and Family Foundation and also the Rotary Club of Saskatoon. You can go into their website and look at the tickets, and if you're interested, maybe you can join on this good event. Before coming to the question, I was listening to the whole conversation about the challenges and what we can do. Just looking at a holistic sort of statistic, WHO said last year that only in 2022, year-to-year increase was 25% for mental health pandemic. And they're saying it as a pandemic because of so much of youth that are getting, into the grasp of it. We know we have our doctors and nurses are doing their best. But I think sometimes we just have to take a step back and see what we can do for ourselves. And not just for ourselves, maybe our friends, our family, our community members. Just say a quick hi, just a text or something, just to check on to them. Now, going on to the interesting questions, I'll start with Dr. Kendall. So we all talked about many challenges and maybe long-term initiatives that we can take. What would be something that can bring us some quick wins, just that we need in a short term?
Well, when we talk about quick wins, I think people often have a different understanding what that means. If we're talking about a single policy, for instance, that if you changed a policy today, immediately there would be a change in the health status of the population or other measurable changes. That's unlikely to happen. In terms of both a quick win but an enduring win, I'd like us to really focus on what we can do to retain our existing workers in the system, because we're losing people. People are actually dropping out because they just can't tolerate the strain anymore. And I think that we often have so much focus on recruitment. So our government has a big recruitment initiative to try and attract people from elsewhere. We attract often healthcare workers from third world countries where they desperately need them more than we do. But, the lure of coming to a developed country and earning more money and sending it back home is quite a lure. So rather than trying to put all this energy into attracting people from away, I'd like to see more energy putting into retaining our workforce and making sure that their working conditions are conducive to continuing to enjoy their careers.
Yeah.
Nice. Thanks, Dr. Kendall. Now off to Dr. Hirani.
Thank you so much for this opportunity. So I would say that many times, like in our system, we do have like various other aspects that we need to highlight on. And I would say that our next generation. So here my focus is on the young children's health, and they are the one who gonna be the future weightlifter of our nation in Canada. Unfortunately, like whenever like I work in my research, and I do see that so much of the lesser investment for the younger generation, especially in every health clinic nowadays, I'm seeing that mothers are being offered the formula samples. And here, like, we don't understand that how much implication it is having on the economical kind of a burden for the whole family. And once like the formula sample is offered to the moms, like they believe that probably if doctor has given me or like healthcare providers has given me, then probably they are giving me the right advice to and to go ahead with at that time rather than any breastfeeding counseling. And here I have seen many families that who had the children who ended up into the GI problems, the gastrointestinal problems in a very early stages of their lives. Many children ended up into a kind of a learning deficit or like a kind of a learning issues when they were in the school. And many were having the immunity based issue with a very low immunity, struggling with those type of the health issues very early phase of their lives, which is not at all good for our like younger generation, because they are the weightlifter, as I said, for our nation. So here I would emphasize that like instead of having something which is a formula like breastfeeding counseling, while having more lactation consultants in our like province or in Canada would actually benefit more. In Canada, like I would say that we have very low number of institutions who are with the baby-friendly initiative status. In rest of the world, there are like all the health organizations and even the hospital settings are trying to have this accreditation so that they can support more mothers to have their breastfeeding continued minimum for at least 2 years or beyond. The first 6 months should only be the breast milk that should be offered to the baby without any water, without any other kind of the juices or any other kind of a cultural food. So nothing in the first 6 months. And after that, mother can have the weaning diet with the breast milk continued up to 2 years and beyond. So that's what something if the more emphasizes on, and that would be the kind of a health promotive strategies for our younger generation, because breast milk is something that is nutritionally right. It can offer the great ingredients for their brain development. It also promotes the emotional bonding between the mom and the babies, can also prevent the young babies from the variety of infections. So this is one of those examples, and many such projects on the childhood immunization, the community-based education are few other aspects, and also main focus of the healthcare providers if are on the early brain development. That would be something very great start for our younger generation from the health perspective that can actually benefit the society at large. So that's what my perspective that really require the more thoughts again.
Thanks, Dr. Hirani. I'll throw it off to Tracy.
Yeah. So quick wins. I think there's
Yeah,
things
good luck
we can,
with that.
yeah. I think there's things we can leverage
Yeah, yeah.
that are on their way. And one of those would be I'm really impressed with the public school division's campaign to address literacy for kids up to grade 3, knowing that literacy is such a key indicator of future success for kids. So I think we can leverage that and invest. That can be an immediate investment that can be made. But I think the other one is around investing in anti-racism and reconciliation, because we have to be able to build trusting relationships. And I'm thinking a lot here about substance use and mental health. We have to be able to develop meaningful relationships with people, help people feel safe to engage in care. So if we can't be culturally responsive and engage with people in that way, we're not going to be able to move to that next step of trust where we can provide care. So those would be two things I think could be immediately invested in. But I think there's another realm that I have some thoughts on, and it's actually palliative care. I think we can make some immediate investments in palliative care education. We talk a lot about, what can we do for folks, throughout their life, but end of life is really important time too. And I think we can invest in more education across the healthcare spectrum for people working in that realm to understand how to deliver good end of life care. So that is something we can do pretty quick and pretty immediately. There's education forums out there that we can latch on to. There's people interested, and from a fundraising perspective, it's amazing how ready people are to give funds to things related to end of life. When we did our campaign for hospice at Glengarda, it was a $10 million campaign. We raised $22 million. So there's some opportunities there to really work on good end of life care too.
Those are some really great examples. Thanks for your quick wins. Any other quick win that comes to mind before we hand it over to Rashid?
Supportive housing, gotta say it.
Yeah.
We just need to really invest in housing that has support systems around it to help people to be successful in their independence.
It's one of the main issues that comes up, and not just in Saskatoon, but all over our country and beyond. So housing the unhoused, and all of that, and looking at the whole wraparound effect of it and transitions and all of that. So I appreciate you bringing that up. Over to you.
Well, thank you so much, and I'm really enjoying the conversation and learning a lot about healthcare system today. We discuss about opportunities, we discuss about challenges and shortcomings. So I will start the conversation with Tracy. So my question is, what really needs to be the long-term focus in terms of sustainability and for future enhancement?
I think a lot of it has to do with planning. We have to plan thoughtfully. We have to look at what our demographics are telling us. I mean, there will be a time where we'll have a lot fewer seniors and a lot more younger people. So we have to plan ahead. This is going to affect us in education, for example, and healthcare, all our systems, all our government delivered services. So using data to make decisions is really key. But I'm going to go back to the determinants of health, because we have to think about what is it that causes unwellness? What is it that it promotes good health? And those are the determinants that we have to invest in. If we invest in the determinants, if we invest in income security, food security, recreation, issues related to anti-racism, we will actually build a healthier society. So those are short-term, long-term, they're just all the time things that we need to be doing. So,
Well, thank you so much. We have to invest not only in the healthcare, but in the society and other factors as well, so that we can improve longer sustainability. So,
and I'll say one more thing about health human resources, because I mean, in the short term, I guess we have a bit of a win because we have had an investment to create more seats in physical therapy and occupational therapy school, which is really important. More nursing seats, the introduction of a physician assistant program. We're not sure exactly what that will look like yet, but there's at least some forward thinking and knowing that we need those health human resources, and that we have to educate people right here in our community or in our province, so that people will stay and serve in our province, like you say, the retention aspect. So,
Thank you. Same question to Dr. Kendall.
Well, I think long term, one of the things that I really think we need to be mindful of is We actually led this nation in 1962 in introducing, publicly funded, medically necessary physician services, now called Medicare. And in 67, it became a national program. And it's interesting that we have this phenomenon in which, we guarantee that all physician services that are deemed medically necessary are paid out of public funding so that no person can buy themselves to the head of the line. But we're seeing in a number of provinces, including Saskatchewan, a phenomenon in which, there's an inclination now to have for-profit delivery, and you can pay your way to the head of the line. And I think that's socially irresponsible. I think it will undermine the fabric of our society. And so I'd like us to remain steadfast in our commitment to sharing the cost of keeping our population well through our taxation and not expecting people to actually pay for it. The other thing that I think long-term we need to be mindful of is if we can, in fact, move towards team-based primary care as the norm, we need to have a diverse array of healthcare personnel working together as true team members to optimize the care. And if you get the foundational primary care services optimally operating, it reduces the reliance on much more expensive interventions later on. So I think primary care needs to be a very long-term investment, and we need to change the compensation model so that all of the workers can be working together.
Well, thank you so much. And as we talk about society, compensation, so I will come back to Dr. Sheila if you want to add anything to the long-term investment.
Another long-term investment that I can propose on is with regard to the sustainable developmental goals. Like nowadays we do have like the whole set of sustainable development goals that speak about the different aspects that can make this world a better place, and talking about specifically the climate action and climate change related investment is something equally important even from the perspective of health, because even the climate change is causing so much of the disaster situation all over the world. And even every day when we tune in to the news, we're gonna get to know that this area is affected by wildfire, or like in this different part there are earthquakes ongoing, or the flooding in progress. So to what extent like our healthcare system is so much well prepared to tackle the repercussions of all those climate related and climate change related disasters that are happening every day in Canada all the time. Like every summer we do have the issue of wildfire that is affecting the great number of population who are even traveling, or even many people are ending up into respiratory issues because of that. So to what extent like we are prepared to handle the disaster that are happening every year, and in the coming years there are chances we may face the massive disaster. So that type of preparedness is something for which we need to think in advance to be able to promote, protect and health of everybody during that time. In past, I've seen many healthcare providers are not very much well prepared of that, how to tackle situation whenever there are actual disaster. So much of their continuing education or even in their own curriculum, there should be more inbuilt on this aspect so that they can care for the population in a great way in long term. And we have to probably plan it in advance for that. And apart from that, I would also add on the interdisciplinary collaboration between the healthcare providers. Like I've seen that many times, like people who are in a specific domain, for example, psychologists, like medicine, nursing, social work, at times like at times they work in their own entities, but now it's a time where we all have to join hand and work as an interdisciplinary team to make a great change for the society at large, especially in Canada.
Well, thank you so much. Yeah, as you mentioned, like working together to improve the system, so very, very important. I will pass it to Lenore.
Yeah, thank you. Just a follow-up question to each of you, because it begs the question, who else needs to be involved in this conversation? You know, apologies, we're picking on the healthcare folks,
Yeah.
right? And that's a heavy weight to bear.
Yeah.
But we know there's a heck of a lot more
Yeah.
and a lot of others that are involved in this. But who else needs to be in this conversation and why? You know, and who's been maybe missing from the conversation and why?
I can't think of anybody that should not be
Yeah.
in the conversation,
Yeah.
to be
Yeah,
honest.
yeah.
I mean, we have to even ask ourselves, what can we expect of a healthcare system? We have very high expectations of what we want for interventions and to keep us healthy, and how far can we actually go
Yeah.
to keep people alive and to cure people and to fix people, and how much can our system actually sustain. So even being able to address societal expectations
Yeah.
about what a healthcare system can do or should do, and what are people willing to pay
Yeah.
in order to have that. You know, when people are sick, it's like $1 million. I'll give you $1 million. Just help me live,
Yeah.
right? But it's not a sustainable thing always, and that's where you see, you know, people wanting to go off to a far-reaching clinic in the United States that does a very specialized service that nobody else in the world does. You know, those things aren't sustainable in systems. So I think we need a bigger conversation around what do we expect our healthcare system to do, so we can work from there.
That's a
Yeah.
good question, right? Building on that, Dr. Kendall.
Well, I guess when we talk about being at a table, we need to have obviously our elected leaders
Yeah.
at the table, because their role is to set public policy that impacts not just health care delivery, but the social determinants of health. We obviously need citizen engagement, and we need engagement of particularly vulnerable populations.
Yeah.
And you mentioned, Tracy, you know, the need for, you know, engagement of the Indigenous peoples. And I think we're making some inroads there, but there's much that we
Yeah.
can and should learn from them about their understanding of wellness and health.
Yeah.
And I do think that when I reflect on my own, you know, sort of journey in Saskatchewan, I grew up on a farm, you know, went to medical school, got a medical degree, got to do some really exciting things. And I think often you read like well-researched papers, academic papers saying this is a plan, but we don't get the right people together to actually implement it. And so we do need to get, you know, politically active leaders and all the other players at the same table.
Yeah.
Right now it's a hierarchical process. And at the end of the day, you know, the Ministry of Health calls most of the shots, and I'm not sure that that's a healthy environment.
Yeah, those are good points, very valid points. Going on to our guest on screen here.
So here I would say that very important to involve the patient partners. Like many times we design the programs, policies, and practices for people who gonna be the end users, or to whom like things gonna be applied to. But it's very, very important to have a say of those individuals, because whenever we involve patient as our partner, just like a health provider, policy maker, other stakeholder, governmental, non-governmental organization representative, or in so many others in the list similarly. But definitely whenever like we are gonna be thinking into those lines where we are involving patient as our partner, we would be getting their perspective very, very clear. We would be getting to know that what their context is, what their needs are, and to what extent like our design policies and interventions are need-based and culturally appropriate, or even context appropriate. Many times like the problem that we face, that we invested so much money into a program saying that, oh, this is the best program, maybe designed by people who thought that this is gonna be the best because they had their perspective, but there wasn't the perspective of those individuals who to whom that gonna be applied. So when we gonna be involving them, we will be saving the great number of dollars in that, because right in the very beginning we would be getting in the planning phase that what needs to be done and how it needs to be done, what gonna work and what would not work, and what will assure the sustainability. So that's something when we have the whole feasibility assessment plan in front of us, that's when we can just have the right approach in place. So I would always say the first person on the list should be the patient partners' involvement in the discussions like these.
Wow. Well, what a great discussion. Time went by too fast. That's what happens every time we have great conversations. But what I hear is we have come a long way in our healthcare and we have long ways to go. And we each have a role. We can either sit back and complain, or we can take a more active part, make our voices heard, and tell people what we expect and what we want our healthcare to be, so that people in charge, they can listen and they can give us what we need. But great discussion. Thanks again, Dr. Kendall. Thanks again, Tracy, for coming back to our show again and again. I'm sure we'll have you guys many more times. And Dr. Sheila for joining us today. It was great having you all and just a great show. I'm sure we'll be back with more great shows. And I hope you all enjoyed this episode. And I guess don't forget to follow our social. We'll be posting this video there as well. Share it with your friends, share it with your family so that they can hear these great conversations. And again, add comments to what they want, what they need, what's missing. So, any
Thank you
last
so
words?
much.
Yeah,
Thank
perfect.
you, everyone.
Thank you.
Thanks to our guests. Much
Yeah.
appreciation.